My next favorite tool for overall health and wellness in general, so it doesn't have to necessarily be for patients with temporomandibular disorders, right? But anybody with spinal mobility issues, musculoskeletal issues, IT band, piriformis syndrome, tightness in their posterior rotator cuff. We really use the Freedom Ball for a myriad of musculoskeletal orthopedic related conditions. Think of it sort of like you might your foam roller, but I prefer this. It is made of a particular density, but it is still soft and pliable. So it's firm, but soft, pliable. To me, it's the perfect amount of all of those factors so that when someone is rolling on the ball, their spine will meld over the ball and become more flexible. Many of you have heard me when I lecture. A big fan of the concept of Joseph Pilates, right? We are as young as our spine is flexible. So part of my goal is to really get their spinal areas, particularly in this case, cervical thoracic area, to be more mobile, because we know of the connection between the spine, the base of occiput, our cranium, and the temporomandibular joint, and maintaining very good relationship and equilibrium in those areas to promote overall health and wellness and eliminate pain. So just a quick tutorial on how we use the Freedom Ball. We have other YouTube videos that'll show you more down the road. But the basic one, if nothing else, I want them doing this once or twice a day. So they're going to take the Freedom Ball, they're going to lay down on the floor. I'm going to get it roughly positioned between the shoulder blades. Very important, they interlock their fingers to fully support their head or occiput. And the goal is that her arms are to do all the work. I need her to relax her anterior neck structure. So SCM, all of these I want to be as relaxed as possible. She's going to bring her heels towards her butt a little bit closer first, right? And then as you saw her, she's going to very gently, just a half an inch or so off the floor, just so her butt is off the floor. She's going to do the best she can. Now, Sophie's fairly flexible, so she's going to let her head drop back a little bit more. And now we're going to have her push her body that way on the ball, down to about T12. I don't usually go into the lumbar spine, of course, until I know more about the patient down the road and that they have really good control just doing this. And then she'll very slowly move her butt towards her heels, but the whole time working to let her head stay as close to the ground and her butt to stay as close to the ground, so that in essence, right, the ball is forcing sort of that stiffness in her thoracic spine, lower cervical spine, into more of an extended position, right? So just trying to increase flexibility to those areas, right? Fight Mother Nature, fight gravity, postural distress when we're sitting in front of our computers all day long. And everybody's different. I'll have them just do very controlled, methodical rolling up and down several times. 10, 12 reps, maybe it's for 2 to 3 minutes. It really just depends on the individual. Once they master that easily, then we'll do more into the cervical spine area with various stretching, neural flossing if it was necessary, then down into the lumbar spine, and eventually, like I said, you can do full body rolling. To me, I think not only for our patients, I think all of you clinicians should have one of these and be using it on a daily basis.